Dr. Rardi van Heest is a highly accomplished and compassionate general surgeon who has held progressively senior medical roles since joining William Osler Health System in 2013 with incredible results. She currently works with cancer survivors and their families to support them in coping with the effects of cancer care treatment and ensures that patients have the right plans in place to support their recovery journey. More recently, she has begun early collaboration and planning for a cancer care center at Osler. As corporate chief of general surgery from 2013 to 2017, she spearheaded Osler's National Surgical Quality Improvement Program, or NSQIP, that resulted in an award from the American College of Surgeons, placing Etobicoke General Hospital in the top 10% of all participating North American hospitals. Dr. Van Heest went on to become Osler's medical director of cancer care, where she developed a cross-discipline committee that laid the groundwork for a regional cancer program. Born in British Columbia, Dr. Van Heest previously worked at the Royal Columbian Hospital near Vancouver as the chief of trauma and has a trauma surgery fellowship from the University of British Columbia and a master's in leadership from Royal Roads University. Dr. Van Heest was also a member of the Canadian National Alpine Ski Team and represented Canada in several World Cup events. Dr. Van Heest, Rardi, welcome to the show.
Thank you. Nice to be here.
Thank you, Rardi. I appreciate you taking the time.
Oh, Josh, it's my absolute pleasure.
Awesome. So, Rardi, you've had an amazing career so far, starting all the way back in the Alpine ski days. And I just want to touch on more around your leadership that's happened in the last decade and a half. You've held many leadership roles focused on inspiring innovation for cancer care, especially in oncology survivorship, as well as administrative leadership roles. What's motivated you to go beyond the clinical care and get more involved with hospital leadership over time?
Well, this is a really good question because it asks about where the germination for this trajectory came from. And the way it happened for me was during my trauma fellowship. So I was seeing one patient at a time, and I noticed that a lot of patients had similarities. There are other patients in other parts of British Columbia, Canada, North America, and I was part of the American College of Surgeons, and we were talking about trauma and where a patient ends up getting injured and having to go to the hospital really affects their journey and how they do. So the only way to really impact all of those patients that I don't see personally was to figure out how to impact the system. And when you think about systems and you think about, so what are the big changers and the big levers, not just doing more with the little time that I have, it's in leadership. It's around, focusing on how to get other people to move with you and how to actually get things done. So I just wanted to be able to impact patients thousands at a time rather than one at a time.
And maybe just to double click that in a little bit, Rardi. So it's not always easy to motivate other physicians to move with you. I'm wondering over the last number of years, anything in particular that you found to be effective in motivating physicians in particular to move with you to something new, perhaps?
When we're talking about specifically, in this case, the digital technology, often as a leader, I listen to what other people are saying. So I hear people saying, well, wouldn't it be better if, how do we reduce ED visits? So almost all physicians are focused on improving patient care. So if you can find technology, innovation that improves patient care, you usually get a fair amount of buy-in, but then you get some sticking because it takes work. So how do you get them to overcome that work? And I think with Seamless, we are going to address it in another question, but what I noticed is that if you do process mapping, which your team has been really helpful with, so we take all of the sticking points, we go, okay, so we register the patient, what does that look like? And then it goes through the various steps in the office. And then why is that email not working? And so we look at all the sticking points individually and we say, we'll help you. Somebody in our hospital talks about the stone in the shoe. Well, we look for the stones in the shoes while we go through this and help remove those sticking points, help remove I call them pain points as well. And make it so it becomes efficient, so it becomes easy. And at the same time, and my call to arms, so to say, is patient care. Is it improving patient care? Is it improving the patient journey? And patient care is not just no infections, it's patient-reported outcomes. So do they like what we're doing? Do you want me to give you a graphic example of a patient-reported outcome?
Sure.
I'll give you a good example here. You can always cut this one out, I guess. So what I found, and this is what I use, I have a patient who has really bad cancer. I remove the cancer. I do a great job, get enough of the lymph nodes out. They survive. They don't have any complications, but they become incontinent. So then they have to wear a pad for the rest of their life. Well, that patient's reported outcome is not going to be good.
Right.
So yay, I won. I didn't get a complication. They didn't get a DVT, but they do have, their outcome isn't great. So I missed the boat somehow. And if you don't look at patient-reported outcomes, you miss the boat.
I absolutely love that, Rardi. And I think what it reminds me of, probably the more common example that we've heard in the surgical world has been, I mean, in some ways, orthopedics is a bit easier at this because they've been doing patient-reported outcomes for longer than some other specialties. But the story that I've heard a lot is, physicians often care about, let's say, functional status of the knee, let's say after a joint replacement and range of motion, or even, surgical outcomes and complications.
Yep.
But if you ask the patient what matters to them, it could be something such as, well, I want to walk my daughter down the aisle 6 months from now, pain-free. That's not on the list of questions that we would ask, but that's what matters to the patient for a patient-reported outcome. So, so your story around, the stoma definitely reminds me of that.
Yeah. And thank you. And ortho in the US really has done a good job of that. And then tracking those patient-reported outcomes over time. So then you can, if somebody says, oh, I'm not doing very well, and yet they're scoring an 8 out of 10, and you say, show them 3 months ago and they were a 3 out of 10, then you can kind of say, okay, yeah, actually, maybe you're doing better than you think. Because we all have perception biases, right?
Yep. Yeah, in the moment compared to over time.
Yeah.
I'm curious, so Rardi, as someone who's now also heavily involved in digital and innovation, leading digital transformation, where does that motivation come from in transforming digital and making the experience better for a patient using digital technology?
Yeah, I really like this question because it made me think again about the why. So do you remember dial-up internet?
Yeah.
With the ringtone, the weird dial tone.
I love that sound.
In the mid 1990s, and look where we are now. I have a handheld device that I carry with me everywhere that is more powerful than any computer that existed in the mid 1990s. And so that is a massive revolution. I think we're ready for that in healthcare when it comes to technology. And you want to talk about touching more than one patient at one time and just kind of going through the slow process. There's a revolution that has the potential to happen, and of course I want to be part of it. Yeah, I like big scale changes. I like making the world a better place, and I can't imagine a more effective tool if we do it right. So the pressure's on for you guys to help.
No, that's awesome. So I did just want to shift gears a little bit, because I think in line with digital technology, one thing that it can really help with is collaboration. And like you're saying, reaching a scale of patients and helping, a multitude of patients also is this collaborative nature of technology. And so I think what's neat is Osler has actually been recognized several times for its collaborative approach to cancer care. It was the first community hospital in Canada to receive an international cancer and palliative care designation. And it's no surprise then to hear that William Osler was the first health system in Canada to implement SeamlessMD for digital patient engagement for cancer care patients, guiding patients through their cancer care journey from surgery, systemic therapy, radiation therapy, and survivorship as well for breast cancer, colon cancer, and lung cancer. What motivated you to be the first kind of pioneer in bringing this technology to cancer care specifically?
Well, thank you for the shout out. We're really proud of that award. It was a team effort, and there was a lot of combined energy that went into it. And I think that kind of speaks to when we see something at Osler that works well for patients, when we and this matches with our values. Did you know that our values include collaboration and innovation and service? And so that's part of the milieu here. And I didn't realize it at first, like when we'd be in a meeting and all of a sudden I would look at something and I'd say, wouldn't this be great for, and then kind of go way out in left field. People would come with me, and I think, Josh was there at that meeting when we were talking about, wouldn't this be great for cancer patients as well? Like, why just stop at the diagnosis? Why just stop at the first step instead of going through the next ones? Because of the patients feel so badly, a lot of them, when they get their diagnosis, and they're so alone, and they're very fragile and vulnerable. And I just want to be able to help them all, and I just can't. So that's sort of where that came from. And it's that idea that we go beyond. That's just who we are. And I'm looking, I've got our promise up here as well. So I've got our strategy and everything on my wall, and it says hashtag going beyond, because we want patients to know that we really care about them, and we care about them enough to think of, are there any better ways of doing this? And it's very much baked in at Osler. And I think that's why everybody was willing to jump on and try it.
I love that. And I guess at Rardi, this whole notion of digital patient engagement, it's honestly still relatively new in the healthcare system, particularly for cancer care. How would you describe SeamlessMD to someone new?
Well, it's really hard to describe because it's quite complex, and I usually try to show them the demo that I have. And so what I'd say is that it's a curated library. So I can go onto the internet and go to Dr. Google, and I can search things, and I know what's real and what's not, but I don't expect somebody without my 16 years of post-secondary education to do that, right? Like, it's okay. You don't have to. We've got it right here for you in this wonderful library that you can access through questions. So, it tells you to fast for a few hours before your surgery. Why am I fasting? All of a sudden up pops this wonderful library, nice graphics with some explanation that has been vetted by our experts here at Osler and experts around the world that have used your platform as well. So that's why I like it. So it provides that at your fingertips when you've got that question, like, why do I have to do this breathing exercise? Because that's kind of crazy, like the deep breathing, really? Well, it prevents pneumonia. Oh, okay. Why do I have to walk after surgery? Those questions that we get a lot, and the other cool thing about it is not only does it have a good search function, but what I really like is that when we get it working well, it carries on through the journey, so that not only do I get an understanding of why I have to show up 5 hours before my surgery when I have breast cancer, because I need to have that tumor localized by the radiologist, and then go up and wait, and then get marked. And a lot of that is incorporated into the library. But at the end of it, I have appointment reminders, because we've got it to work within our platform here, our appointment platform here. And patients really like that when you're really anxious. I don't know about you guys, but most people's brains turn off. So when I have a doctor's appointment, I get all nervous. My blood pressure goes up because I have a bit of white coat syndrome, and I forget everything. So SeamlessMD is here to remind you of your appointment, remind you to breathe, remind you why you're doing it, and you get sent reminders. And again, those get tailored. So that's what I would say. That's how I describe it.
Rardi, actually, what you just mentioned reminded me of one of the very first patient users we had way back, I think it was back probably in 2014, was kind enough to share his experience going through Seamless. And he actually was a cancer surgery patient. And he said the exact same thing. He said, normally when I see my surgeon or my physician, and when you're just being told that you've had cancer, I just stopped listening in that first meeting. And then I go home and I ask my wife what happened in that meeting. So I just did not absorb any of the instructions for preoperative or anything else. But the nice thing for him was that he opened up Seamless, and to your point, all the reminders and the education were there. So it was okay that he blanked out during that difficult encounter with his surgeon. Now he had that information afterwards. So anyways, that's resonated with me ever since. And it's amazing to hear that sort of opportunity to improve that experience for the patient is still true today. One of the things, Rardi, that I always remember is when you were and Oza were going through evaluating, even bringing this in for the first time, I remember you told me, I think you shared the application with a family member, I think who may have been older, because you wanted to see from firsthand from a patient who may not be as tech savvy, can they use this? So I've always been impressed that you actually took it home and had someone go through it. That doesn't always happen. So just want you to know that. Yeah.
Oh, thank you. So I live my life as an experiment. I try things. I go home and I try different things. I try different types of exercise. I really do use myself as an experiment as much as possible. I mean, certain things I'm not willing to do, like, that are dangerous.
Right.
But I'm not afraid to experiment and to see. And I liked the feedback from my they were my in-laws, because they really are not tech savvy. But it just, like, the interface was really nice for them. So I really like that.
We were lucky. So when we first started Seamless, it was a little bit of a like throwing darts against the wall in terms of like which patient populations we'd start with. And just by chance, we started off primarily working with older, frailer, more complex patient populations. So we were forced to design the experience at the very beginning for a population that often didn't have good access to technology. So I'm glad we did that, because if we had started somewhere else, like if we had started this, I don't know, working with 30-year-old patients having ACL surgery, it may not have ended up being as patient friendly. So I think we're actually quite lucky that we were forced to work with older patients from the start. So it worked out well, actually.
Yeah, and that's a good point. But can I also tell you that as I was thinking about where we are, where we've come with Seamless, we are still doing a lot of iterations. So you allow your team to work on it in an iterative process, so that if we do get feedback that is more critical in nature and really kind of points out some of the things that we could improve upon, you're willing to do that with us. And that also is sort of one of the hallmarks of the way we like to do business, which is, sure, we can accept that we're not perfect right off the bat, but we're willing to go back and look at it again and fix and tweak. And I've got to shout out to your tech team. They're pretty great. And we really, really appreciate that opportunity to, like, make this an iterative process. So as much as you say you got lucky because you had that patient population to start with, I think that you would have gotten here anyway, just because of the type of company that you are.
Well, thank you, Rardi. I appreciate that. And actually, to your point, I think that's one of the nice things about the collaboration and it being so iterative. So, I mean, I think paper still plays an important role in the healthcare system for different reasons. But the nice thing is that, I probably in the past, if you wanted to make a change to the patient education materials, you may have to, I guess, bundle in that feedback once a year, once every 2 years, and then reprint everything. But your team has been so nimble. If your team saw an opportunity to improve something in the program, we can update it pretty quickly together, and then it can go out to patients right away. And so that's one of the nice things to your point about going digital, is that beyond the impact can actually be more real time, can be more modern, can be more updated. So that's been really, really fascinating, actually, to see that play out. Of course, it's not easy to bring in innovative real-time stuff like this and digital into healthcare. It does take a lot of buy-in. And obviously yourself, Rardi, you were a key clinical champion in bringing this in and getting other folks, bought into this new innovative concept. I was just wondering, what was that process like in terms of rallying the team to get on board with this sort of newish technology? And how did you handle any pushback, if there was any?
Well, there most certainly was pushback, because there always is. And again, it was that, when you show this to physicians for the first time, they usually say, wow, because it is pretty cool. And then they start poking holes in it and say, okay, well, what about this? What about that? And we just answered their questions. And we just go through, getting the physicians up to speed, getting them to help put input into the actual app itself. So, when you've asked somebody to provide you with feedback and to give you, to contribute to the library, they do buy in. And then the other piece was around the extra work that it takes to get it going. And that was the process mapping that we did. Sort of looked at the processes, we looked for those pain points, we looked for this, the where we could actually change things to make it work better. And also using the patient journey and the patient in the background as the important focus, rather than, it's really, I'd just rather have the patients write it all out so nobody can read it and then fax it. And faxing in the 21st century is just the antithesis of modern, right? So again, it's taken time. It's still taking time. Like, we're not at, everybody's on it and thinks that, the sun rises and sets with Seamless, but I have other departments and divisions now pushing. When can we get on it? It's a great platform. And while you might not make everybody happy, I've got more than 80% of people happy who are using it, I believe. That's my, and so that's why we sort of stress that ability. And what are the good things in the end, like the monitor that we have, the dashboard. I really like the dashboard because it gives you an overview, more than one patient at a time, right? I don't know if you know, in my office, and when I had my own office outside of the hospital, my assistant would have to write down all the patients' names and keep a running list of who was where. And so if you get super busy, that's not a database. But we've got the dashboard now with Seamless, and so that's a great way of working on it. And so those types of, when you make fewer errors, when you've got things more up to date, it's really helpful.
I like that, and especially requesting input from your physicians as well, just getting them to be more engaged and involved, and then they can naturally gravitate towards seeing the benefits once they're using it and giving their own kind of input. One of the ways that William Osler has used SeamlessMD, aside from cancer care, especially during COVID-19, was by implementing a digital care plan for pre and post-op care across elective surgeries. And this allowed Osler to go fully digital in collecting things like pre-op anesthesia questionnaires and conducting pre-op COVID-19 screening for patients. Could you share a little bit more about how you're using SeamlessMD to optimize the pre-op anesthesia data collection workflows and the value that that's brought?
So when we have it all online, and it's using that dashboard to communicate between the staff in the offices, because they're separate, right? They're in separate parts of the city sometimes. So instead of phoning, instead of faxing, you can look at the dashboard. And so once we train people to look at the dashboard, the pre-anesthetic clinic can look at the dashboard and they can read, okay, so Dr. Van Heest's office has asked for an anesthetic consult on this patient. Check, we can arrange that. This patient filled out something that flags them for, they've got blood thinners, and okay, check, they need to be seen a week in advance so that we can stop them. And we're not perfect at that, because I just had somebody say, oh, I had to cancel a patient because didn't get to pre-op anesthesia soon enough. But we can work on that in the dashboard, and we can use that as that iterative process. How do we improve, our workflows to get that? And so that's why we like the dashboard, is you can see it all in real time. And then if you end up having to change your OR day around, the patient gets a notification, which I love, because then the patient is kept in the loop. So the surgeon's office, if they're closed for the long weekend and something happens and it's done at the hospital side, then the patient will be notified, through the app as well. So that's one of the things. The other thing during the pandemic is that what would happen is that all the patients would be phoned by the pre-op anesthesia office, regardless. And so they would have to be the COVID questionnaire, as well as, are you vaccinated? So if a patient fills that out through the app, it updates the dashboard in the background, and the nurse who is in our anesthetic clinic can look at it and say, oh, check, everything, we don't need to do that phone call. And then we know that they have their OR date and that it's correct, because we've kind of amalgamated the two into our back office with the Picis and our PAC system. Well, it's not our PAC system, it's mostly just Picis.
Right.
But it really, really helps, because and then the other thing is I don't have to worry about the fax not getting there. Do you know how many times you have to phone to make sure that the other side got the fax?
Well, yeah, you're checking balance on the fax.
Yeah, it's awful. And you have to rely on people's handwriting.
Right.
I remember, I mean, gosh, this happened 10 years ago, but Rardi, you can tell me if this still happens in a hospital, but 10 years ago, I remember working in the hospital and we would fax between floors because we couldn't securely transmit documents that well in the hospital. I'm not sure now if you still have to fax between floors at Osler, but I wouldn't be surprised if in some hospitals it's still a common thing.
It still is common, and also the tube. I don't know. Do you remember the tube where you put things in a pneumatic tube and then fire it off to where? Yeah, not cool. It still happens.
So one of the funny things that happened during COVID, I guess, was a lot of sort of workflows or opportunities that we maybe people had talked about in the past, but a lot of times we would have said, no one's going to do it that way. COVID forced us to do. So to your point, going digital with some of the, preoperative anesthesia questionnaires, maybe in the past we would have said, I don't think enough patients would actually be able to do it. Well, you had no choice now. And so you went digital, and a lot of patients are doing that now. Kind of reminds me how before COVID, we still had, teleconference meetings with partners and other team members. But in the past, it wasn't very normal, at least for us to, go on video, even to meet, a hospital partner. Because we always thought, no one wants to turn their camera on, but then COVID forced you to turn your camera on because you couldn't do in-person meetings for a while. And now, even though you could go back to in-person very often, people are still turning their cameras on. So turns out people are okay with that. So it makes me wonder how many other things that we do in healthcare where we assume people can't do them or won't do them, but you actually would if you just were forced to, and then you got used to it,
Yeah, well, never let a good crisis go to waste, right? Mm-hmm. And so that's really what we want to do. But we need to take that in the context of how difficult this has been for a lot of people. Mm-hmm. And so when you kind of look at it in the context, the way I talk to my patients about it is, I need to see you in person for certain things. I will let you know what I think you should be seen in person for. So like my first patient examination. Certain types of cancer surveillance must be in person, but the rest of it, you want your results over the phone, I can phone you, no problem. So there's this hybrid that's going to happen, I think, and I think we need to be really mindful that it is partly about patient preference, partly about workflow, but also about safety. Mm-hmm. And so I think we're going to hit a middle ground somewhere, and then we'll need the next revolution. So I'm hoping that we can utilize technology to get us into the next phase. So I agree. Isn't it nice that we're not getting faxes for our pre-anesthetic questionnaires anymore? So now I don't have to worry that it's going to go to the florist somewhere in Mississauga instead of, to the hospital. And that's just part of how, what you think about risk when it comes to the antiquated technology that we use in healthcare sometimes. Mm-hmm.
Yeah, absolutely. It's a very patient-centered perspective to have as well, to really consider, what is best for the patient in terms of both safety, but then also preference and understanding where's the balance in between and where can technology really help us improve that workflow.
Yeah, well, because we've swung too far one way, right? And we're going to go back, and then hopefully we'll find that middle ground, that nice place where patients really are truly supported.
Right. So the other interesting part of the technology that Osler has put in place is integrated SeamlessMD, like you said, with the Meditech EMR, as well as the Picis OR manager to automate specific data flow between the different platforms. Why is that important from a workflow perspective, and how has it helped for day-to-day operations?
Well, ultimately what it should do is it should be able to give us the ability to be more proactive. So getting flags that are actually meaningful to the clinical workflow. And I think we're still working on this to get it right. So what is a good predictor of a patient needing to be canceled the day of surgery for safety reasons? Well, all of those predictors, we can flag them. We don't know what they are. We're working on that. We're working on the data crunching and the analysis. But when we get to that point, then when I go for my for whatever surgery I'm going to have, and I fill out that pre-op anesthetic questionnaire, hopefully it will generate a little bit of a picture of my risks of infection, my risk of surgical cancellation, my risk of perioperative pneumonia and allow us to be more proactive and to prevent things. Now in Meditech, we've already done that in the ICU. And we've done that to alert the ICU roving team which patients need to be looked at. And we've reduced our ICU admissions by 50% through that. And so I'd like to see something similar within the technology that SeamlessMD has brought and by talking to Meditech. So that takes time though, and I know you guys have been very patient with us, so I appreciate that. But that is ultimately the goal, is to be able to be proactive and to prevent things. Because kind of like what we do with seatbelts, it prevents injuries. So I'd like to be able to prevent certain things, and there's only so much predictive analysis you can do. But in medicine, there are some things I think that will pull out of that analysis.
Yeah.
So just more context for kind of the audience. So to Rardi was sharing over the past year, William Osler and Seamless, we've been collaborating on kind of a machine learning models to better predict risk of certain adverse outcomes. So let's say, I think readmission was a key metric we were looking at to see if we can kind of catch those much earlier using the full data set. So a lot of the data about the patient traveling through that journey. And kind of the idea would be, can we pick up a patient at risk of readmission much sooner than, a month after their surgery? Can we pick that up sooner based on the data? And Rardi, just not every hospital, frankly, probably most hospitals wouldn't be ready to explore this type of novel approach to patient care and leveraging machine learning to improve things. Like, what motivates the William Osler team to be open to being pioneers and innovative in this way? Because just be honest, like not every group would feel ready to be the first to do something, but what's so special about the culture there that makes this possible?
I think, like I said before, it's kind of baked in, like everybody thinks like what you come up with a really good idea and you don't get everybody saying, well, no, we cannot even look at that. That's way too difficult. Artificial intelligence, predictive analysis. Oh my goodness, way too much. People are already thinking about it. We've got clinicians like our quality champions. We've got, our nurse quality and our interprofessional groups are already thinking. So what can go wrong? How can I prevent that? How can I make the patient's journey better? And I'll talk about, again, our COVID experience. Did you know that you can run out of oxygen in a hospital? And it's because the pipes are it's all physics. The pipes are a certain radius. And so one of our leaders, who's also a respiratory technician, an RT, a respiratory therapist rather, he went and tested all of that. Turned on cranked up the oxygen everywhere. And they did some tests to see what's our maximum capacity.
Wow.
Because we bring the scientific method to work. Like I said, I experiment on myself. Well, my colleagues, we experiment on all of these unknowns, and we're always trying to get the information and figure out how to use it to our operation and our organization's best advantage to enable good and excellent and improving patient care. So it's kind of all of that.
Mm-hmm.
I think, Rardi, one thing that you mentioned that really hit home was it sounds like the culture at Osler is very much about how could we make it work? How could this be successful? As opposed to a culture where it's, well, this won't work, or here's why it won't work. So I really love the fact that there's a really great optimistic approach to how can we make things better and how can we find a solution. That I found that too in my experience in other places, that sort of culture really is necessary to do things new and better. So that's wonderful to hear. The other thing that the other team has been really great about is accessibility with the patient experience. So William Osler, for those who don't know, is in a very multicultural community. You're serving 1.3 million residents in Brampton, Peel, Etobicoke, and other communities surrounding them in the Central West region. And your team has actually been very progressive at saying, hey, we're going to make Seamless not only available in English, but also in Punjabi, Urdu, Hindi, Portuguese, Italian, French. And so it's available to many more patients, regardless of language spoken. Why was it so important to your team to make sure that this experience was available in all those different languages?
Well, more than 45% of our patients, English is not their first language. So if you truly want to be community focused, you need to look at your community and provide what it is that they need. So we have a diversity officer, and she existed before I even joined Osler. And I found something about Osler with Gurwinder Gill is her name. And I'm like, of course I want to work in an organization that, 9 years ago in 2013 had a diversity lens and thought about the community and had that type of outreach. So it was her office that provided me with that list of our top 5 languages for you to use. I have used it multiple times on multiple platforms in Ontario, like with Cancer Care Ontario, to get materials that our patients can use. Because if they can't read it and if you can't understand it, how can you participate in your healthcare?
Mm-hmm.
And if you're not participating in your healthcare and you're kind of in a back seat, you don't actually have the improvement from the interventions that we would like you to have. There's really good evidence for that. And it's partly what drove my desire to see a really robust patient library, because if you're truly informed and you're making truly informed decisions, then you're able to participate in your healthcare and you actually do better. And like I said, there's actually good literature around this.
Mm-hmm.
So it's a very important point. So thank you.
Absolutely. I think we're all on the same page where numbers don't lie, and the data, you have to look towards the numbers to understand what's going on. And one thing that's neat with the SeamlessMD experience at Osler is patient satisfaction rates with SeamlessMD. At Osler, I think the last time I checked, it was about 90% of patients have recommended SeamlessMD to others after using it at William Osler. Could you share any specific patient stories where the technology has helped your team or the patient?
Yeah, so last week I was in a physician's leadership forum for Osler, and I talked to our medical director of the Cancer Care System, the person who came in after me, who was wonderful, and I said, "How's Seamless going?" And she's like, "Funny you should ask. I had a patient this week who said that she likes it, especially because of the reminders, because she's an oncologist, and this is lung cancer, and the medications really do affect how you can think. Sometimes you get brain fog from the chemotherapy, and she said that they really enjoyed the reminders. The other thing I think that people really like is that when you go home, and in COVID we've noticed this, people feel unsure, like, what do I do? I don't know what, like, does a little bit of a cough mean anything? What about a little sore throat? Like, if you get intubated, you have a sore throat, right? So a lot of patients really like how this information is there, how easy it is to access. And I'm gonna call attention to the orthopedics program, because we're offering SeamlessMD with a dashboard that's monitored for our total hips and knees. So those are the hips and knee replacements. And we're sending those patients home on the same day as their surgery or post-op day 1 in way higher numbers than we did, because we're confident that the patient has a way to contact us. They can fill out things in their questionnaire. We use the dashboard to look for signals of some severe issues. Patients can send us photos of their incision. We like it for the prehab, so you can do the exercises before, you can do the exercises after. And then on the dashboard, it really helps because the patients are automatically entered into the dashboard through the background communication. And what we really like about that is then the nurse who's going to phone the patients the next day has that list, and then can just input a few little comments and kind of knows what the issues may be. So I think that the feedback from that has been very robust. Patients really, really like it. We also, I wanted to call out, was that patients feel like they can call less often because it's already being provided for them. So they stop phoning as often, which is, I don't want them to stop phoning. You need to, but if the answers are provided for them in a way that they can use, great. And then avoiding the ED. Right. It's a big deal, right?
That's fantastic. Yeah, it almost seems paradoxical, because you're hearing patients are not phoning as much, but then when you dig into it, you're finding out, it's because they have their questions answered. So when they do phone in, it's maybe, more serious or something that they do need help with.
Yeah. Or maybe we haven't answered that question yet.
Right. And then the iterative process, we can add that to the next version. That's great. I'm curious because we've mentioned these dashboards, and you've just mentioned how the nurses will actually go through the patient comments and write back to them or call them the next day. What have your clinicians said about the technology?
So the clinicians typically really like it, provided it makes their workload less. So they don't really want to interact with the patients on the platform, but they like how it makes it easier for their offices or easier for the monitoring to go on in the background. And I think, you know, when you're talking about a large community hospital with a lot of patients, I think it's reasonable to do that monitoring in the background, and that's part of the patient journey. So they really like that. Definitely. They, you know, the pandemic helped us in a way, because I could tell the physicians that they had a little bit of extra time because their ORs had been canceled, and they could use some of that extra time to review. And so they actually used some of their time during the pandemic when things shut down. Do you remember in wave one? The government shut everything down, which was pretty awful. So a lot of clinicians used, you know, a couple hours or so to work on this, and it was slow enough because we now have 3,400 patients on this. If we'd gotten all of those in the first 2 months, we wouldn't have survived.
Right. So
we did take advantage of how hard hit we were to use that time and to spend that time wisely. So I think the physicians do like it. They do like the efficiencies, and I think they were able to participate more in the onboarding efforts because we had slowed down a little bit.
Right.
And Rardi, to your point, I think one of the biggest lessons we've learned over the years is, fortunately, there's a lot of innovations out there that can help patients and improve patient care. But unfortunately, the healthcare system is very complicated. Workflows are very complicated. There's so much going on inside, the hospital or the clinic setting, that anything that, unfortunately, even if it improves patient care, if it can't somehow fit in the clinical workflow, if it can't streamline the operations, you just can't make it. You just can't keep adding more and more things to the healthcare system. It's just too complicated. It's going to be over capacity. And so to your point, one of the things that's been really fascinating is, even though there's a lot of hype, to be honest, around, let's call it remote patient monitoring and collecting real-time data and sending alert and pinging the healthcare team for every little thing that's recorded on a platform. One of the things that we realized over the years was, okay, well, that's not going to work for every clinician or organization. Some of our partners, they're lucky. They have lots of clinicians available, and they turn on 1 million alerts, and they look at 1 million dashboards, and they're able to do all this real-time monitoring. But we have some other partners who only want half of those alerts turned on because that's what fits their workflow. Or there's others who can't do any alerts and monitoring because they just don't have that resource available. But to your point, Rardi, like, they love the fact that patients are saying, hey, I'm calling in less because the program is telling me the answer right away. I don't want to wait on the line for 20 minutes to get a provider to understand how to manage my constipation. Like, that's not really an emergency, and I don't want to be on the line for an hour, and the clinician doesn't want to be on the line for an hour handling something that you really should have been given to the patient independently. So it's been really important for us to understand that even though something might just seem in principle great, like real-time monitoring, it doesn't necessarily fit every workflow, and we have to be mindful of that from a clinician point of view. It's just, we have to be practical, I guess.
Yeah, and our clinicians appreciated that, because they were right up front about it. They said, we can't do more.
Yeah, and it's funny because I think when a lot of people outside the healthcare system, especially, let's call it technologists, try to solve this problem on their own, it's easy to assume that technology is the answer to everything in healthcare. But then, as you know better than we do, the reality is, no, it's not just technology. It's the implementation, it's the workflow, it's all these complicated things in healthcare that we as outsiders have to become more mindful of. And I think we're getting better at it. I think the industry is getting better at it. But if you haven't lived in healthcare, I think we often don't realize that it's a lot more complicated on the inside.
Yeah, and change management is an important key to being successful in the technology sector in healthcare. The other thing, and the way especially in my vice president of medical affairs role, what I've learned is that each one of my divisions with how many patients they see. So I'm thinking of, chronic kidney care. I'm thinking of cardiac, cardiology and cardiovascular services. Each one of those, and that's one of 16 or 17, they're large enough to be a company in and of themselves. Like we're talking about like 8,000 plus employees. We're like, healthcare is large, and we're just one hospital system. And we're a large one, but we're not the largest. And there are multiples. So when you think about it, in order to understand medicine, is that you have to understand that we've got like the equivalent of 20 international companies all working together under one roof and trying to collaborate. And I think it's because we are so willing to go beyond and to really seek out the best possible alternative for our patients that we're able to be successful.
That's great. It's just a fantastic kind of mindset to carry, in a culture that sounds like it's quite evident at Osler, and one that you have. Rardi, you've also shared in the past your personal journey regarding being a woman in STEM and how you want to be a role model and how to be a role model for women pursuing a similar career path to your own. What would you say to women who are not only interested in pursuing medicine, but also want to or have the desire to become a surgeon, where many of the top specialties is still dominated by men?
So what I would say is that there's nothing about gender that predicates a career choice. Having two X chromosomes does not make me uniquely disadvantaged in any way, shape, or form to be a surgeon. So don't listen. Don't listen to anybody who says that you can't do something because you're female versus male, or otherwise. I mean, I think it is just immaterial, and I don't put up with it.
Right, plain and simple. No, that's fantastic. Definitely agree with that. So, Rardi, we're coming up to the hour, so and obviously we don't want to take up all your time today, although we'd love to. Because I mean, we could go into the whole skiing and everything and chat further for hours, but we do have what we call the Fast 5 lightning round. And so this is just really 5 questions to get to know you better for our audience. And so I'll just go into those now. So the first question we have is, what is your favorite book or book you've gifted the most?
Green Grass, Running Water by Thomas King.
Okay.
And the reason why is, I don't know if you know this, I'm also part Métis Cree from Northern Alberta. I'm a quarter. That's a quarter of my heritage. And it really does get you into the mind of what it's like to live with the trickster and those stories, those Indigenous stories. It's a really cool book.
Yeah,
and,
awesome.
And Thomas King is a national treasure.
That is awesome. I've added that to my list.
Okay, good.
Sounds good. Question 2, how has an apparent failure set you up for greater success?
Oh, I've got a doozy. So I took 5 years off between high school and university to ski race. I went to university after that 5-year break and I got 9% on my first midterm.
No.
9%. And I was in science. And I'm like, I just didn't accept that failure defined me.
Yeah.
So I just figured it out. And I struggled and I studied and so, and it didn't define me. So I don't think that failure defines you, but how you respond to it and move through it really, really impacts the future.
So question 3 is quite a bit different. Would you rather have super strength, super speed, or the ability to read people's minds?
I would like super strength.
Awesome.
Please.
Yeah.
Do not let me read people's minds.
No,
it's awful.
That's when we do have guests who come on and they say, "Oh, I'd like to read people's minds." We always ask as the follow-up, "What if you couldn't turn it off?"
Oh,
yeah.
No, I'm sensitive enough. I don't need to read minds.
Well, Rardi, I thought you were going to say super speed so that you can keep winning all those ski races.
Well, didn't I already do that? I think it's time for another skill.
Oh, okay. Oh, good answer. Good answer.
All right. Question 4 that we have: what is something in healthcare you believe that others might find insane?
We don't follow our own advice. There are a whole bunch of healthcare providers who smoke.
Oh, yeah. Yeah.
You know, or you look at a cardiologist who doesn't follow a good diet, or,
Right.
you know, I'm like, so
Yeah.
I don't smoke.
Yeah. Yeah.
Actually, Rardi, I'm curious, do you think that like that makes a big impact on patient adherence if they, I don't know, see their physician doing something they told the patient not to do?
I don't think so, because I think patient adherence is really complicated. I think it has more to do with why can't we be compliant as physicians when we know all the data? It's because adherence is really complicated. And I think society plays a bigger role. So do we want to get into big food and the industrial complex around fat, sugar, you know, those types of things? And so I think that so when I talk to my patients, I don't want them to feel bad because I adhere to these things, but I also don't want them to feel bad because they don't. And we can talk, and so it's complicated.
We need a whole other podcast.
Right.
We do. It would be a good one.
It would. Last question that we have for you, Rardi. This is a COVID-19 lockdown related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
You mean other than pandemic puppies?
That's a bit of trend. Yeah. Did you get it? Did you get one?
I got that one behind me.
Yeah.
Yeah, a little puppy. That was our second dog. But what I really did is I started, I was able to do online training. So I increased my Pilates workouts from once a week to twice a week. And it really made a huge difference for my strength.
Awesome. Yeah. And I think that's probably here to stay as well, because I know like different Pilates studios, they found, you know, it's just more feasible. So you can accessibility. It's like, you know, same with healthcare. So now we can broaden the accessibility range.
You can, and so I can do it from my office if I need to, so I don't have to not train during the week. Whereas normally, like with my meeting schedule, I would, at least for the days that I'm here, I wouldn't be able to do the training. And so it's really nice because it's really helped me to stay fit enough to do this job.
Right.
What you do is if you're in a meeting, you turn the camera off, and then on the side you open up a different window and you turn the Pilates on, and you just talk.
While talking to patients.
Multitasking, it does not stand you in good stead when you're trying to build your muscles. And I do have a neck injury, and so it's been really important for me to stay strong and not kind of like, if I sit too long, I have to worry about my ergonomics. And so it's been really helpful.
And being mindful with the movements. Yeah.
Yeah. And having somebody watch you and they're like, oh, are you turning on the wrong muscles there? And we kind of tweak things. And it's very important for me to have that feedback.
Yeah, absolutely.
It really helped me a lot.
Totally.
Immensely with my neck and my neck pain.
That's awesome. So, Rardi, I know it's come up to the hour now, so we'll have to let you go. But I do want to just thank you again for coming on the show with us today, sharing some of the wisdom, your personal leadership style, and explaining, you know, how you've rallied the group and what the innovation is like at Osler and how patients have adopted this digital technology. It's been really a fascinating conversation, and I hope our audience has learned as much as I have on this conversation. It's been really fantastic having you here today.
Thank you, Rardi.
No problem. It was my pleasure. I like hanging out with you guys. We can do this again.
Definitely come back. That's awesome. Thanks so much, Rardi.